Hello everybody, I am Punima and I am a family second year student. Today I am going to explain you about fatal familial insomnia. So we are very familiar with the word insomnia, which is lack of sleep. Many of us suffer from insomnia. So what is fatal familial insomnia? What's new in it? So fatal familial insomnia is a rare genetic condition which causes sleeping difficulty. So insomnia is lack of sleep, whereas familial insomnia, that is fatal familial insomnia, is a genetic condition which is causing difficulty in sleeping. So there is no cure, but the treatment temporarily slows the progression of the symptoms. As you can see here, there is no sleep and no sleep at all in fatal familial insomnia. So what is fatal familial insomnia? It is a part of prion disease which affect the brain functioning, and it typically emerges from the age of 32 to 62 years. Now, what is the etiology of what is the cause of the fatal familial insomnia? Obviously, it is a genetic disorder, hence it causes due to gene mutations, critical codon, and inheritance. Now, how does fatal familial insomnia affect our body? So, FFI targets your brain and the central nervous system when the proton caused by genetic mutation cluster on the part of your brain and controls the functions like sleep. So, it is affecting the part of the brain that is thalamus, which is mostly responsible for the sleep-wake cycles. So, the most severe symptom is not being able to sleep, which affect our mental capabilities and how our body functions. Symptoms can be life-threatening and is also get severe over the time. So pathophysiology. Let's learn how it happens. First, let's get to know what is the normal functioning. So prion protein PRPC is harmless and normal. It is encoded by the PRNP gene, but due to the mutation effect, it causes misfolding into abnormal PRPSC protein, which leads to harmful aggregation in the thalamus. The impact is neuronal death and thalamic atrophy. So sleep-wake cycle is disturbed and atomic functions get disrupted. Now let's learn what are the clinical manifestations, that is, what are the signs and symptoms of it. So stage 1, insomnia worsen with panic attacks and phobias over first 4 months. But in stage 2, that is from 5th month to 18th month, you start to hallucinate and agitation starts, then autonomic dysfunction occurs. In stage 3, there is complete insomnia, there is no sleep at all, and there is a weight loss, there is dementia. Obviously, if there is lack of sleep, your brain won't function properly, so there will be memory problem. In stage 4, mutism, coma, leading to death usually within 6 to 12 months. As I said, it is fatal and severe over time. Next, so diagrammatically, if we say this, so sleeping problems which causes difficulty and staying asleep. Behavioral symptoms like you get distracted very easily in this condition. There might be anxiety and cognitive impairments. Muscle disorders, because our brain is not functioning properly, there might be muscle movement disorders like muscle twitching. Autonomic dysfunction like high blood pressure, hyperventilation, irregular heart rhythms. Then what is the cause of this death among these FFI people? So the cause of the death with FFI is damage to the brain and nervous system. This damage is caused by the prion proteins accumulated in the thalamus, which creates symptoms of insomnia and the mental deterioration. Next, diagnosis. Identifying IFFI. How can we diagnose this FFI? Sleep studies like polysomnography shows lost or reduced sleep spindles in genetic testing, PET scans, MRI scans. And what are the treatment options? As you know, it doesn't get cured, but we can reduce the symptoms. So there is no cure, but treatment only addresses symptoms, not the disease itself. Sleeping aids often ineffective as the thalamus is affected totally. So experimental drugs like doxycycline trials show limited benefits. Palliative care is essential to improve the quality of life. We can go for a cognitive behavioral therapy, supplements, acupuncture, sleep hypnosis, meditation, and melatonin. Then, what are the prevention? As FFI is caused by genetic mutation, there is no way to prevent the disease in individuals who carry the mutation. Lifestyle changes, balanced diet, sleep hygiene practices, and taking vitamins are not very much effective in preventing the FFI. Some treatments like medications for sleep or muscle spasms may alleviate the symptoms but do not cure or prevent the disease totally. So guidance for the families with FFI history to understand the risk might help in prevention for future. Prenatal testing and pre-implantation genetic diagnosis available. Next, so insomnia symptoms are headache, malaise, poor concentration, fatigue, impaired performance. What are the reasons? Medications, heavy food, stress, alcohol, crossing time zones. This is only for the insomnia. If you're talking about fatal familial insomnia, along with this genetic condition is the main. And what are the prevention? Bedtime, early bedtime, light dinner, meditation, avoiding alcohol and coffee. These are the differences I have referred. If you want to know more about it, you can also check through this. And thank you for listening.